My pleasure to be here, and I want to thank you for joining us. As you know, earlier this summer, I appointed David Carpenter as our official administrator for Alberta Health Services. I want to thank him for assuming this role while my colleagues and I worked on a long-term governance plan for Alberta Health Services. I'm pleased to announce that we have determined that long-term plan. This morning, as Minister of Health, I've appointed a new board to govern Alberta Health Services, and they are Linda Hughes as our chair, Dr. Brenda Hemelgarn as our vice chair, David Carpenter, Hugh Somerville, Marlis Taylor, and Glenda Yates. And in addition, Richard Discerny, who is the Deputy Minister of Executive Council, will serve on the board, bringing a strong connection between Alberta Health Services and our government. More information about these board members is included in the materials that we've passed out to you today. Stable and effective health care is a vital concern to every family in Alberta. And I'm confident that this group has the first-hand knowledge of healthcare delivery and governance that's needed to strengthen and stabilize that health system in a prudently and sustainable way. In addition, the board has significant experience in public administration and solid fiscal planning, and these tools will be critical to making the system effective in the long run. I'm confident that we've assembled a team able to provide the oversight that will ensure Alberta Health Services is able to give patients the care they need by the right healthcare provider in the right place at the right time. But I also want to acknowledge that there's still more work to do to make sure that this team is equipped to serve all Albertans. I'm reaching out to the Indigenous partners that we have, including the Grand Chiefs of Treaties 6, 7, and 8, as well as Métis representatives, to ensure that Indigenous representation is on our Alberta Health Services Board. We need to achieve better health outcomes and improve services for Indigenous Albertans. This new board will report directly to me as the Minister of Health. Government will work closely with the board to ensure health services are well managed, efficiently delivered, and responsive to the needs of Albertans. As well, I will work with the board to set long and short-term objectives and to monitor whether the organization is achieving those objectives. I firmly believe this governance model will enable us to achieve our goal of better health care for us all. Having the right board members and using the legislative accountability tools that are available will result in strengthened, sustainable health care. I look forward to working with our new board members, with Alberta Health Services, and with all of our healthcare providers. Using our collective wisdom and experience to make prudent decisions, we can create a more sustainable, fiscally responsive, and sustainable patient-focused system. Thank you.
So, please comment about the Indigenous leaders.
Yeah.
Will you be adding them to this board? Is that the idea?
I've reached out to most of them already and have one phone call left for today to tell them about moving forward with the board, and of course one of our big objectives being closing that gap in terms of health outcomes for Indigenous people. I told them a little bit about the type of board I wanted and asked that they give names for me to consider adding at a future date. So whether, how many will be determined, but I look forward to meeting with and connecting with their recommendations. And I think that that's actually what consultation is not appointing somebody and saying, what do you think of the people we've already done, but actually reaching out in a collaborative way, and they've been very responsive to that.
So the AHS CEO reports now to the board.
Yes, and today reports to the official administrator.
And the board reports to you.
Yes.
So why do we need a middleman, so to speak? Why don't we just, I mean, if they're going to have to take direction from you and report directly to you,
Yeah.
what do we need them for? What can they handle independently that requires them to be there?
Well, in terms of the current legislation, there is somebody between government and the Alberta Health Services CEO. So whether that's the official administrator or a board was something that we were working through in the last few months. What I think a board brings to the table that an official administrator doesn't is a wide variety of expertise. So as you can see from the names we're proposing, we have people who have frontline healthcare experience. We have people who have legal experience, who have accounting experience, and I think that brings a greater leadership to the CEO in running Alberta Health Services.
They'll take broad policy direction from you, obviously. So what have you given them, or what will you be giving them in terms of the structure, or what broad policy outlines will you be giving them marching orders, I suppose?
So they get policy and they get budget from government, and really they also get our end goals, and they're in charge of helping make sure that there's a plan to get from policy and budget to those long-term outcomes. In terms of committee structure, that might be one of the ways that we can speak to that. I've talked to them. We're going to be creating 4 different committees, technically 5. One is quality and safety, community engagement, audit and risk, and then finance is another one, but it'll probably be the same members serving on audit, finance, and risk, and then governance and human resources. So through a subcommittee structure, which they'll have the ability to add additional members from communities, from different regions or different expertise in the community, they'll be able to supervise in those specific areas and achieving our long-term goals.
Have you decided?
Dean, can we give somebody else a chance and then
Just one
catch a
question.
second
Have you
round?
decided what the form of the system will be? For example, the Tories were going to go back to a more decentralized system.
We're having one health region, Alberta Health Services.
So that's done. We're not
Yeah.
going to be changing that at all.
Yeah, too much chaos, and we've heard that fatigue of change was something that people were pretty exhausted with in terms of frontline health service providers. And as an Albertan and my neighbors, we want to make sure that we have the right services available to us in our communities. Whether it's one board or multiple boards, we want to make sure that the right services, the right professionals, that you're getting the right care at the right time, as close to home as possible, is the guiding value. And I'm confident that we can do that with one board.
Minister, how are you handling the compensation levels for
Yeah.
these individuals? And then do sub-board members also receive?
Committee members?
Yeah, 6-figure salaries and?
Nobody will be receiving a 6-figure salary. So the chair everyone's going to be, everyone's here for the right reasons. I want to start by saying that. I'm very confident that they're motivated by wanting to give back to Alberta and contribute to our long-term success. And there will be compensation. It will be less than the previous board was compensated at. The board chair, for example, will receive $50,000 a year, and there will be an honorarium that's tied to meetings. But there will also be a cap at a per month maximum of up to $3,000. So regardless of the number of meetings, we don't have to worry about there being massive salaries. And we can give you all the rest of the details, but everyone will be compensated at a level lower than that with which previous boards were compensated. And they're fine with that.
Will you be, there was some concern with previous boards that that the Tories were using them as scapegoats, basically, to whenever there was a larger problem, they would just point to AHS. Are you going to be, if there's something goes wrong with the system, are you still responsible for it, or is this going to be a board problem?
I don't think that strategy worked with the past government, and that's definitely not my strategy. One of the reasons I'm being really clear about there being a clear connection between government and Alberta Health Services is the appointment of Richard Discerny and his willingness to play that role in helping make sure that we operate in a really thoughtful way. So there will be responsibilities that the board has, but I know the buck stops with the minister, and I'm fine with that.
You mentioned that legislation states that there should be a board. Why don't you want to change this? Why do we need a board?
The Regional Health Authorities Act?
No, the AHS Board.
Yeah, so there's a Regional Health Authorities Act as the governance, the piece of legislation that determines what the structure is. And I think that a board, and this board in particular, will bring a really great level of expertise to help us run Alberta Health Services. And I think that was the intent of the legislation originally when it came to pass. And I think that we've got a tremendous pool of talent and an amazing number of people who are willing to help us run an efficient, effective, patient-focused system. And I think that we need to take them up on that offer.
We'll go to the lines. We will come back to the room one more time. But I think we have Jillian Slade waiting to ask a question. Operator?
Jillian Slade, your line is open. Thank you. Good morning, Minister Hoffman. We're hearing about more management, more bureaucracy, more committees without a significant change for what's happening at the patient level and giving more control at the rural level. And I wondered if you could just speak to that, please.
Thanks, Jillian. These committees or similar types of committees already exist. They're right now reporting to the official administrator. We'll actually have the expertise of people sitting around the board table also serving on these committees. So I think that that's a significant advantage. In terms of rural expertise, we've got a wide variety of perspectives serving on the board. Hugh Somerville, one of our board members, is a rural lawyer who practices in rural communities, definitely has expertise. And through the creation of our Community Engagement Committee, there's definitely going to be increased connections with our rural providers and rural citizens who expect that quality care. So I'd be happy to follow up with you if you have other questions specifically on that committee at a later date, but that's the intent at this point.
May I just do one follow-up on that? Do you intend at any stage to cut some of the layers of management?
The board knows that part of their requirements is to make sure that we have fiscally accountable system. So that will be part of my expectations for the board, that they're rolling up their sleeves, they're looking at the management structure and working with the CEO to ensure that we have appropriate oversight, but also efficient and financially responsible oversight.
Thank you.
Thank you.
Operator, can you confirm that there are no other questions on the line? Oh, looks like we have Chris Varco with the Calgary Herald.
Mr. Barker with the Calgary Herald, your line is now open. Good morning, Minister. I'm wondering if there's going to be any formal mechanism for input from the various regions of the province to the board itself.
Thanks, Chris. So we currently have health advisory councils and provincial advisory councils, and I think that they have been in a state of limbo for a number of years. And in conversations with these members who put their names forward to serve on the board, I did talk a little bit about the role of the health advisory councils, and I think they'll be working with the Community Engagement Committee to ensure that there's a feed-in loop there. So there are some different community representative models that I really don't believe have been used to their fullest capacity, and I expect that that's one of the things that the Community Engagement Committee will be moving on. And there are a lot of people who've served for a number of years. We really want to honor and value their expertise, and also welcome new community representatives as well.
Just to follow up on that, was there a sense when you were looking at putting this board in place that this regional representation issue was a problem with the previous board?
That there wasn't enough regional representation?
That there wasn't enough sort of, I guess what I would say is an official mechanism for regional representation to get into the old board structure?
I think we reflected a lot on what we saw as the outcomes of the last board and how we could avoid those being our outcomes moving forward. So, of course, when people put their names forward, they were aware of the fact that the last board had been fired in a very public way, and that disconnection from community was one of the drivers. And I think that they are keen on making sure that that is not the outcome, and so am I. We want to make sure that they're effective and that regional voices are respected.
Okay, we'll take two more questions from the lines. We have Kiera on the line from State Polytechnic who wants to ask a question.
Hoffman from State Poly, your line is now open.
Thank you. My name is Carol Hoffman. I'm from Calgary. Minister, now that this board has been formed, what do you believe is the most pressing issue in Alberta healthcare for you all to take on?
Oh, thank you. I'd say that there's two parts. One is that our costs have been escalating at a significant rate in excess, somewhere between 6 and 9% a year for at least the last 10 years. That, of course, is not sustainable or ideal moving forward. So making sure that we bend the cost curve, but at the same time ensuring that we have the most effective and confidence in frontline services for Albertans. So again, no matter where you live, that you have the assurance that you will have a healthcare professional in a timely fashion meeting your needs. So balancing those two sides of the same coin, I'd say, on terms of sustainability, stability, and patient confidence with bending the cost curve.
And now we will go to Rick Dolphin on the line.
Rick Dalton with Insight to Government, and your line is now open.
Yes, Minister. I'm just wondering, Linda Hughes is the chair of this committee. What exactly is the expertise that she brings to this? She's a former newspaper publisher. I don't quite get the connection.
Sure. So she definitely has financial expertise from being the publisher and the role that she played there, but also she served on for the University of Alberta, the Board of Governors, and possibly the Senate as well. So she has tremendous governance experience from being at those tables, and she chaired those as well. So she understands that. She's also got connections through the United Way, Capital Region as former chair. She's been a community leader, and I think that she can run a very effective meeting.
Second question, David Carpenter, who was the official administrator, stays on as a board member. Will he continue to receive the same salary he was getting for the remainder of the year or a given period?
So the date effective of the transition will be timely. We do have to just reach out and make sure that we're clear on what dates work for an orientation process with the members. So the date that the board becomes effective, he will no longer receive the official administrator salary. So it'll be only a few more weeks. At that point, he'll receive a board member compensation, which is less. But we can make sure those details are up on our website for everyone.
Okay. Rick, sorry, we have to go back to the room here, Rick. Thanks for your questions. We'll do one more round in the room here.
What policy direction have you given the board in terms of privatized services under the public health umbrella? Do you want to, is it status quo? Do you want to see it rolled back? Do you want to see it increased?
Well, of course, one of the pieces that we're working through right now is the Edmonton and North Zone for lab services, and we're working through the evidence that's available to us before I give any direction, but that they will get direction on the lab service piece as soon as that review is done. Generally, I want evidence-based decisions, and I want a sustainable system. And of course, part of our platform was to stop experiments in the privatization of healthcare. They're very aware of that. Also, in the ideal candidate search profile, I talked about a commitment to the Canada Health Act, and they are well aware of that when they put their hand up. So, so those would be some of our guiding values, and details around specifically lab services. We'll be following up with them in the days to come.
Just a couple more questions from the room.
Overall, Minister, I mean, you've had 5 months to assess this system. AHS has not had a great track record in terms of the dysfunction that you're well aware of. What have you found? What do you want to see fixed with AHS?
I want to start by saying I think I have tremendous respect for frontline healthcare workers. I think that they are doing an amazing job in and out. And we actually had a first quarter update on AHS satisfaction, both from patients and other mechanisms of measurement. So hand washing's increasing, patient satisfaction with the care they're receiving is increasing. The vast majority of indicators on where our health system is moving have improved, and that's a positive trend. In terms of the management structures, that's something that we really need to ensure that we have confidence in moving forward, and that's why I've put this group with tremendous expertise. Another one I want to touch on is Glenda Yates, former Deputy Minister of Health for Canada and significant experience in running the CIHI, Canadian Institute for Health Information. So she understands a lot of pieces about our current system, and I think we'll be able to bring some of that outside expertise here as well.
I wonder if when you were speaking with AHS about bringing back a board, did you get a sense of what was the impact of the former health minister's decision to get rid of that last board? How did that impact upper management and decision making since 2013?
I think the main thing I heard from Alberta Health Services themselves is that they wanted stability, just like Albertans. They wanted some clarity around what governance model was going to be serving them moving forward. And I think that there has been a great sense of ease when I talked about the fact that I was going to be moving forward with the board, and when I informed them that I'd be naming a board today. I think that people understand what a board means and what some of the roles will be that those individuals will be carrying out. And I think that this is going to provide both that sustainability in terms of the financial oversight and the stability in terms of the governance structure.
We have time for one more question.
This was a board, though, that didn't understand that when you go abroad, you should turn your cell phone off. What marching orders have you given to this board in terms of enforcing some fiscal accountability at AHS, particularly in the executive suite?
The compensation has been addressed in terms of individual compensation, and I know that myself and all Albertans expect every dollar that anyone who's got access to public funds treats that dollar with the utmost respect and responsibility. To be honest, I don't anticipate that our board will be spending a lot of time out of country. I think they're really focused on making sure they're providing the right services for Albertans.
What it meant, Minister, is what is this board going to do to make sure that we don't have repeats of flagrant abuse of taxpayer dollars?
We're going to have a very effective orientation process. We've already talked about it in the interviews a little bit, and like I said, they're here for the right reasons. They want the news to be about the good outcomes they're achieving at Alberta Health Services, not about personal expenses, and that's one of the reasons why they're going to be serving on this board.
I have a question on something else, if we can do that. Is that all right?
Sure.
What about, what's the fate of the cancer board following the release of Dr. Paul Grundy?
I'll have to follow up with you afterwards. I'm sorry, I don't have an update to give you at this point, but we can get you something later today.
Will it continue? Will the program continue? Physicians are telling us they feel the program's now at risk.
Sorry, Lydia, I'm really going to have to follow up with you. We'll probably arrange it for within an hour of this ending, but I do need to make sure that I have appropriate information.
Thank you, everybody.
All right.
Have a good day.